this video, I'll tell you an easy way to remember the rationales of the periodontal treatment. So basically, you have to remember there are six outcomes, and we can remember it by 4 REN. So there are four R's, one by E and one by N. So starting from the first thing, if anything is injured, so the first thing would be repair, all right? So by repair, what I mean is you need to remember the definition word to word. So repair is it restores the continuity of of the diseased marginal gingiva and reestablishes a normal gingival sulcus at the same level on the root at the base of pre-existing periodontal pocket. Now, basically, to make you understand in an easier language, so basically, what we see is there is a periodontal pocket, but the body tries to repair it. So, basically, what it will do is it will try to, after scaling and root planning, what will happen is there will be a reflex to restore the continuity of the diseased marginal gingiva and to establish a normal gingival sulcus, but at the same level. So, there is no gain in attachment on the root at the base of the pre-existing periodontal pocket. So therefore periodontal pocket is still there. All right. Now coming on to the second one, which is the new attachment. Now new attachment is defined as the embedding of the PDL fibers. Now, this is important. Embedding of the new new word is important. New PDL fibers into new cementum and attachment of gingival epithelium to the tooth surface previously denuded by disease. All right. Now here, what we see is there are new PDL fibers that are being embedded into the new cementum. Also, there is an attachment of the gingival epithelium to the tooth surface, which was previously denudated by the disease. Now coming on to the third one, which is the reattachment. Now, by reattachment, what I mean is it refers to the repair in areas of root not previously exposed to pocket, such as after a after surgical detachment of tissue following a tooth fracture or during treatment of a periapical lesion. All right. Now, the fourth one you must remember is regeneration. It is easy to remember. It is basically by the name only you'll remember the natural renewal of a structure by growth and differentiation of new cells and intercellular substances to form new tissues or part. All right. Now you can remember the fifth one, which is epithelial adaptation. Now, in epithelial adaptation, it is different from the new attachment because it is the close approximation of gingival epithelium to tooth surface with no gain gain in height of gingival fibers attachment. All right. In this, the pocket, it is not obliterated completely. However, we will see that there is absence of bleeding. There is absence of any stainable plaque on the root surface. Also, there is clinically visible inflammation that is absent. All right. Now, the last outcome that is left, since we've done 3 hours, so 1 hour is left by 4 REN. So, the last one is the ideal outcome or the rationale that we want, which is the periodontal reconstruction. Now, this is the process of regeneration of cells and fibers and remodeling of periodontal structures. So, in here, what you will see is you'll see three things. One is the gain in attachment level, formation of PDL fibers. Give me a sec. Formation of PDL fibers. Then we will see that the level of alveolar bone is significantly coronal to the one present before treatment. All right. Now, a very important thing is the Melcher's concept, which we'll discuss in the another video. So I hope I made it easier for you to understand. We'll just revise once again. Repair. It is basically the restoration of the diseased marginal gingiva plus the normal gingival surface, but at the level of the pre-existing periodontal pocket. All right. New attachment, new PDL fibers into new cementum. Okay, and there is attachment of the gingival epithelium to the tooth surface, which is previously generated by the disease. All right. Now, in reattachment, what happens is this basically occurs in areas which were not previously exposed to the disease, but or the pocket, but they were exposed due to surgical detachment during the treatment of a tooth fracture or during the treatment of any periapical lesion. Now, regeneration, it is basically the natural renewal of a structure by the growth and differentiation of new cells and intercellular substance to form new tissues or path. Now, epithelial adaptation is important because it is different from new attachment. There is no gain in the height of the gingival fiber attachment, only there is close approximation of the gingival epithelium. We can make it out by the name itself. All right. Now, the fourth R that was left was reconstruction. This is the ideal which every periodontist strives for. This is the process of the regeneration of the cells and fibers as well as the remodeling of the tissues of the periodontal structure. So there is gain in attachment level, formation of the PDL fibers, and the level of the alveolar bone is significantly coronal. That is, the bone loss has been treated. Yeah, so this completes the rationale of periodontal treatment. However, it is incomplete. The answer is incomplete if you don't mention the Melcher's concept, which I'll discuss in another video. So thanks for watching. I hope I made it easier for you. Do subscribe to my channel. Thank you.